Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about CBD, what is it, and what is its potential role in helping to provide pain relief and pain management after or before knee replacement surgery. Hey everyone, Dr. Luke Peterson here. So today we're talking about CBD. And CBD is one component of what you would think of as cannabis, as marijuana. So marijuana, cannabis is the actual plant that you think of. And within marijuana, within cannabis, there are specific cannabinoids. What these are basically chemical compounds that have different properties and do different things and affect the body in different ways. And so one of those active compounds, chemical compounds that you find in marijuana is CBD. Now there's 85 plus different cannabinoids. Probably the two most common and most known are CBD, and then you also have THC. And the psychoactive properties, the properties that make you high, so to speak, that comes mainly from the THC, the chemical compound THC that is found in marijuana. So if you're just using CBD and not having THC or have a very low amount of THC, then you're not going to have those psychoactive properties. You're not going to get high from using this chemical compound. And so that's one kind of misconception or misunderstanding is with using CBD, you aren't going to get that psychoactive properties. You aren't going to have a high, very unlikely. So what are some of the benefits of CBD and using CBD? So there's been a lot of research and a lot of things out there that shows that it helps with pain relief. It helps with managing inflammation. It can also help with dealing with anxiety and depression and psychological factors, and it can also be very good at helping to promote sleep. And so the benefits of this is CBD is a little more natural, or quite a bit more natural, I guess you can say, and has a lot less side effects than other pain relieving strategies, more specifically narcotics, opioids, pain medicines of that nature. So if you're able to use CBD, something that has very low side effects and can provide very good benefits in terms of pain relief, that's a great option and a great alternative than using narcotics that of course have a lot of complications, a lot of risks and side effects with them. So a couple of the drawbacks just quickly as well. There are some drawbacks. CBD medications and drugs and supplements are much less regulated than your typical pain medicine that's out there and available. And with everything, there's definitely a trend of more and more different companies and different things on the market, and it's just very not well regulated. So you have to be careful and do your due diligence and research about what company you're using and what products you're using. It's not going to be covered by insurance, so you're going to have to pay out of pocket for it, which is a drawback. And there are some potential side effects. There are things like nausea, just feeling of fatigue and tiredness, and general irritability as well as a potential side effect, some of the major ones. So that's some things to keep in mind. And it's also, be sure if you are going to use CBD or consider using it, to be aware of what other medications you're taking and maybe talk to your doctor about it, or not maybe, you should talk to your doctor about it, because there can be some interactions with other medications that you may be taking. So there are a handful of different ways that you can ingest, that you can take CBD. So there's oral, so taking it by mouth, sublingual, which is underneath the tongue and then letting it dissolve into your system that way. There's inhalation, so inhaling, smoking, for example. There's topical creams and lotions. So for example, with knee pain or after a knee replacement, you can put it all around your knee joint. And then for people who are in a little bit more serious condition, you can also have suppositories. So that is an option, obviously not the first choice. So there are benefits and drawbacks to different ways. With the oral or the sublingual, it's going to go through your whole system, which is something that may be good or bad. It might take a little bit longer to start to feel the benefits. With the topical application, putting on the cream or lotion, that can be very good because you can isolate it to a particular body part or a particular region, which is really beneficial, and the medication doesn't have to go through your whole system if that's something that you want to avoid. So there are some definitely drawbacks to different ways of ingestion, and you should look into that a little bit more depending on what your benefits are or what you're trying to achieve with it. But there are different pros and cons to each. But overall, CBD oil can be very beneficial, a very good pain relief alternative. Not well regulated right now, not well totally understood, although there is quite a bit of research out there of its benefits. Relatively low risk, and something that can really be a helpful aspect to your pain management and pain relief throughout your knee replacement journey. This has been the Need to Know Show. Thank you very much for watching, everyone. As always, be sure to subscribe. If you have questions, if you have comments, I'd love to hear them. I'd love to interact with you. I try to get back, try to reply to everyone that I see, and be sure to leave any information or questions that you might have. Thank you very much for watching, everyone. Have a great day.